The residency has established that drive and passion to become better, and I think with that, having the resources that you have, you get involved with the profession more, you meet other people who are at the same level or want to have that drive, and I think once you start integrating yourself with other people who have that passion, they recognize that, and I think that only puts you in a position to take the next step, the next level.
This allowed me to venture out of my comfort zone and see a lot of different areas of practice.
One of the biggest benefits is the connections you do make. Especially in the fellowship program. I graduated from the fellowship, and so the opportunities that have come about from that, from the individuals that I've gotten to meet, including opportunities to partake in research and teaching that I never would have had the opportunity to do before.
The contacts that I made, the people that now that I can call colleagues from across the country, different research opportunities, there were many good points of completing a fellowship.
There was so much diversity offered within the program that I was able to teach a little bit in the UD PT curriculum. I was able to be with local doctors and physicians in their office and in surgery, and I was able to mentor students in the clinic during affiliations, as well as start doing some publications and treat on top of that. So the variety of it all was really great. The challenge was finding time to do it all and balancing your schedule with all the demands.
I just have more tools in my toolbox. And by that I mean, functional outcome measures I can utilize on certain patient cases to be effective in my clinical delivery of care. And above all, my level of my outcomes with patients has improved drastically. And I think at the end of the day, that's probably the biggest change in my clinical practice.
With fellowship, I have one-on-one interactions with my mentors every single day. They're there for me. Also, I can apply that independently and get immediate feedback.
I'm an older therapist, and their question is always, why are you doing this now? My question to them is, why aren't you? The reason that I chose to do a fellowship at this point in time is to have the ability to work with other clinicians that are master clinicians, and to have the ability to do mentorship with them, and to have somebody take a step back and look at me and my practice and how I work, and offer me tips on my own posture, my own body mechanics, my own clinical reasoning, and be able to have to defend that has changed my practice significantly.
We're given so many opportunities to interact with different professionals, given a lot of time with the clinical experts in our own facility who bring so much to the table in terms of their experiences and their research and things that they can share with us in our kind of the early stages of our career.
I look back to 2.5 years ago, and I'm a completely different physical therapist now. A more confident physical therapist.
The residency has developed that platform from which you can now take the opportunity to advance your career as far as you want.